serve as one of the many staff members to the commission. I am also here representing our chair, Jessica Wheeler, who is the deputy director. She was unable to be here today, so I will be serving in her place as chair for today's meeting. So again, I want to thank you all for joining us here today. And Christine, can we move on to the next slide, please? Oh, and so just some considerations for the group as notification. This meeting will be recorded. We understand if folks may not be comfortable sharing their video, but the meeting will be recorded and will be shared on the commission webpage. We also ask that people mute their mics in this virtual space. We would like to avoid feedback loops and make sure that we can hear everyone that is speaking. We would encourage folks to utilize the chat and the raised hand function so that we can make sure that folks are recognized and folks have the opportunity to share their thoughts and their feedback. And then also to members of the public are present. So for our members of the public, if this is your first time in this meeting space, welcome. And for returning members of the public, thank you for continuing to come back and support the work of the commission. Next slide, please. So this is just a brief overview of our agenda today. This was sent out along with the meeting materials. So we're going to provide a couple of updates about the report and the visioning retreat, but we are very excited to have Dr. Yo with us, who will share some more information about the work that is happening at the Maryland Department of Health. And so we look forward to turning over time in our meeting to Dr. Yo to share that work and opportunities for collaboration with this group. And also we recognize that though we have had it on the agenda, we haven't had time for work groups to report out. So we're really hoping to hold that time for work group members and work group chairs to report out on the work that they have been doing over the past couple of months. So that is the goals for our time today. So with some welcoming and introductions, I have the great pleasure of introducing a new member to our team for this summer. We have, through the Governor's Summer Internship Program, we have Aubrey Gerhardt. She is a rising senior at Stevenson University, and part of her project will be supporting this commission. So I'm going to turn it over to Aubrey for her to introduce herself to you all.
Hi, everyone. Thank you, Christina, for that introduction. I'm really excited to be here today. My name is Aubrey Gerhardt. I'm studying criminal justice and psychology at Stevenson University, and I'm set to graduate this December. I just started as an intern here at the Governor's Office of Crime Prevention, Youth and Victim Services this summer in June, under the Governor's Scholar Summer Internship Program. And my primary role here is under the youth division with the trauma-informed care. So I'm going to be playing a big part in with the commission, not only helping out with the visioning retreat, but also the strategic plan. So I will definitely be reaching out to everyone, within the next upcoming week, just to follow up and just get to know you guys better. And I look forward to working with you all.
Thank you so much, Aubrey. And so we're so excited to have Aubrey here with us. So like Aubrey said, please look out for some follow-up emails from Aubrey. And also she will be supporting the work group. So you might start to see her if you haven't already seen her in those places and spaces. So we're really excited to have her to the team, and we would really encourage all of our commission members to share, your expertise with Aubrey and support her in her work with us this summer. Before we get started, I know Kelly, do you have for the role? Is there any clarifications that you need at this time?
No, I think I am all good unless you are a new designee who hasn't been here before. Then please let me know. Other than that, I
Thank
think
you
I'm
so
good.
much, Kelly. And Kelly will continue to monitor as folks join. So please look in the chat if she needs, reaches out for some additional clarification. So moving along with our formal part of the agenda is the approval of the May minutes. The draft minutes were shared with commissioners prior to the meeting. So I will, we did not, Christine, I believe, we didn't receive any proposed amendments or changes to the minutes. So I will open it up to any motions from the commissioners, either for amendment or approval.
Motion to approve.
Thank you, Frank, and thank you,
Second.
Elizabeth. So we will just do, is there anyone opposed to the approval of the minutes? All right, seeing none, the minutes are approved, and we will post those onto the commission website. So also moving on, just want to update everybody on the Commission's FY22 legislative report. Thank you all for all of the feedback and all the work that you have all done at the work group level and as commissioners at large for supporting the completion of this report. We are excited that during the e-vote, that the report was approved, I believe unanimously, Christy. So thank you all so much for reviewing that report. I know we had a shortened timeline, so we appreciate everyone reviewing and submitting their votes. So for us, we are just putting, we will kind of clean up and make sure all the appendix are put together, and our office will submit that report to the legislature on behalf of the commission. So we are on track to have that submitted by the June 30th deadline. And so then once the report is submitted to the governor and the legislature, we can post that on the commission website, and that document will be available for any additional distribution that commissioners would have. Yes, Claudia, it was approved with all of the suggested changes that were provided. So are there any questions regarding that, or just with the next steps? Okay, seeing none. I also just want to take a moment to thank not just our commissioners and our work group chairs for their work on the report, but I also want to give a shout out to Christy, who in a very short time of stepping into this role, took on one of the Herculean tasks of drafting the report for the first time, and working with all of the work groups and all of the commissioners to ensure that the content was there, that all of the pieces that were reflecting the work of this commission over just under the past year were included. And so I just want to give Christy a shout out for the work that she did for putting together the report and facilitating all of the feedback in the vote. So I just wanted to give Christy that shout out. All right, so now it's my pleasure to turn our attention to Dr. Yo, who we are very excited to be here today to share about the work that is happening with behavioral health ACEs data. And I'm going to turn it over to Dr. Yo.
All right, if you could release the screen, I can share my screen. Hold on 1 minute and we'll get started here. Okay, You all should be able to see this now. Good morning, everyone, and I just want to thank the Commission for inviting me to, and my colleagues to talk to you about some of the work that has been going on in Maryland before the Commission, to hopefully inform your work going forward and to introduce an exciting new project that will be getting underway in the next month or two. As you know, I am Jay Yo, and those of you who don't know me, I have been with the Maryland Department of Health and the Behavioral Health Administration for just over 5 years as the Director of Applied Research and Evaluation, really using data to inform program decisions and policy direction. Before this, to give you just a little bit of background, I was with the Maine Department of Health and Human Services for more than 20 years, doing similar work, but really involved in trauma-informed work going back to the early 2000s, where Maine was one of the first states to initiate a trauma-informed children's system of care for children with serious behavioral and emotional challenges. This was before, people were really talking about sort of trauma-informed systems. So we were carving the way. SAMHSA funded this initiative, and we actually developed one of the first organizational assessment tools to monitor our progress with that. Before that, I really worked a lot with the development of children's wraparound services. This takes me way back into the 90s. Much of that service is a trauma-informed approach. While we did not talk about it that way back then, it's collaborative. It was bringing agencies together to really treat the most seriously challenged kids in the system. And I'm still involved in wraparound work to this day with the National Wraparound Initiative. But that work really got me started in this, and have since worked on developing trauma-informed systems using data to support those systems going forward. So what we want to do today is a few things. We really want to give you the landscape of what has been going on in Maryland sort of before the Commission. We're going to talk about our participation in the National Governors Association Preventing ACEs Learning Collaborative, and some of the products that came out of that, the development of an ACEs state action plan and data work group that has been ongoing, and I'll talk to you a little bit about the time frames around that in a minute, as well as work we did to put together an ACEs data inventory and the methods and findings. We also then want to introduce you. Here today I have Dr. Tiffany Beeson and Dr. Joanna Prout with the University of Maryland School of Medicine to introduce you to a new project that has not yet started yet, but really is the project to look at really building out the data collection, analysis, surveillance, training, and technical assistance around ACEs. And they will be presenting sort of on their approach to this. So first, back in the fall of 2020, a group of us found out that the National Governors Association had their Center for Best Practices were working with 4 states around an initiative called Addressing Childhood Experiences Learning Collaborative, and they were working with a number of our sister states, Pennsylvania, Delaware, Virginia. They also had Wyoming, which is sort of an outlier there. We reached out to them to see if Maryland could benefit from learning from these other states and what they were doing, and they basically invited us to become part of the collaborative. The National Governors Association provided technical assistance for helping us to think through an ACES action plan, which is very high level and really a starting place for the commission to work with and do whatever, really build it out. And they also provided opportunities to meet with mentor states and really to help us and to think about strategies and implementation of an ACES, ACES and trauma-informed state. And many discussions and opportunities to talk about innovative and evidence-based policy and practices and how other states were moving forward with their initiatives. I know you heard from Mary Rolando from Tennessee. She was very involved in sort of helping to provide technical assistance with the National Governors Association. So a small group of us worked with the National Governors Association, which included the Governor's Office on Crime Prevention, Youth and Victim Services, which is here today, the Opioid Operation Command Center, SCAN, or the State Council on Child Abuse and Neglect, Maryland Department of Health, the Behavioral Health Administration, as well as our public health partners, and the Department of Health and Human Services, while this collaborative is no longer, we ended in, August of 21, we ended the National Governors Association participation, but they initiated a multi-state trauma and resilience network that started in October, where a group of states are meeting on a very regular basis to continue the collaboration that was started as part of the collaborative. And I'll talk a little bit more about that. So to say real briefly, in terms of a vision statement we worked with the National Governors Association on, I want to preface that this is a starting place, not an end product. This was a small group of people who talked about and tried to build out with the National Governors Association a statement. So the key elements here were to promote and support resiliency. We really wanted it to have a lifespan perspective, that we're really looking at, ACEs and trauma-informed care across the lifespan. Also that it was collaborative, that it really brought together government, business, youth and families, faith-based communities, etc., to promote and facilitate community health, well-being, safety, by preventing and mitigating exposure to childhood trauma through both policy and cultural change. Again, this is really a starting place that we put together as part of this work. Some of the goals of the National Governors Association work that were part of our state action plan was to develop a state action plan with measurable, time-bound, and relevant goals. Again, there's a very high-level plan that is available for people to look at, or you can make it available. There was a data component for Goal 2 to create an integrated system to identify and track ACEs exposure in Maryland, and to develop an ACEs data tool. And we'll talk more about that because I was very involved in this component of it. And the third goal was to increase adoption and implementation of evidence-based approaches for preventing childhood trauma. One of the first things we did as part of the data component of this was to develop a state data work group with a number of participating state agencies. The Governor's Office, again, the Opioid Operation Command Center, SCAN was involved, have been involved with this. MDH, Public Health, as well as the Behavioral Health Administration, the Department of Human Services has been continually involved, and the Maryland Medicaid Administration has been a more recent involvement. This group was established to really build out and learn more about the data landscape around ACEs and trauma-informed care in Maryland, to talk about developing measures around ACEs, and to really promote ACEs and trauma-informed care work through data. So we promoted a number of presentations at different agencies based on data. We've had presentations at the group. The group has been meeting monthly all the way up until this Tuesday, where we decided as a group, and this was always part of the plan, to integrate this work with the metrics and assessment work group of the Trauma-Informed Care Commission. So going forward, the work of this group will be taken over by the metrics and assessment work group, rather than trying to manage two different processes. One of the key things we did as part of the data work group was to develop a ACEs data inventory for the state. I just wanted to talk to you briefly about this, because I think this can be relevant to some of the work that you're doing and provide sort of a foundation of where Maryland is with ACEs data. So the whole purpose of this was to collect information on ACEs and ACEs-related indicators, data sources, as well as trauma-informed care initiatives from state agencies and partner organizations, to really understand or to try to get a perspective of the ACEs landscape in Maryland. Some of the methods that were used, my office mostly did a relatively comprehensive literature review on national and Maryland state level ACEs and ACEs related indicators, reviewing a whole number of sources on the indicators. From that, we developed an inventory. Inventory was had 85 indicators across 6 domains, which we'll take a quick look at. This is available on the Google Drive of the Metric and Assessment Work Group. Obviously, I'm not going to go into the weeds with all the indicators, but we then took this inventory and went out and interviewed a group of state agencies and partner organizations to sort of get an idea of what they were doing, what data elements that were on the template that they were actually capturing. We got a whole number of tools that people were using and reviewed those tools. Even with agencies we didn't meet with, we were still able to look at a lot of documents and tools that they were using, some of which had ACEs data. And they provided feedback on the inventory and sort of the next steps in its development. This is a copy of the inventory that's available for you. As you can see here, it has 6 domains, sort of a child individual domain, a family household indicators, child development and educational indicators, justice related, child welfare, and community and neighborhood. And we captured a number of different pieces of information, ACEs related indicators, indicator source, whether it was available in Maryland, the data source of where it came from, and sort of the data stewards for the resource. And then we worked with the agencies to build this out. So let me get out of here quickly. Oh, good, it worked. I was worried that I was going to get stuck somewhere and not be able to get back. So the methodology, real quick, was to we reached out to state agencies to to schedule interviews, came up with a set of 8 questions that we reviewed. Usually it was with a group that was put together at each of the agencies. We ended up interviewing 4 agencies, MSDE, Department of Human Services, DHA. We also got a lot of information, like I said, from agencies in terms of the tools they were using. So we had other information where we weren't able to do. We also put the instrument out to the Maryland Association of Behavioral Health Authorities to look at what was going on, at least in the behavioral health world, in the different jurisdictions. So real quickly, of the 85 indicators and meeting with the agencies and reviewing documents, Maryland was capturing in some way 53 of those elements, so not too bad. The caveat here is that many cases data was collected on very specific populations. It didn't cross sort of a broad spectrum of folks. So it's hard. There's not a whole lot of consistent data collection around ACEs other than the Behavioral Risk Factor Surveillance Survey and the Youth Risk Behavior Survey, which are the key, are the key data surveys capturing, ACEs data in the state. And you can just see here that, the individual level items were the most frequently captured, a little less so in household. And you can see with the community and neighborhood piece, we have very few. Capturing most of the elements we found for justice and child welfare indicators. And these were some of the data sources that are used across, that we found are used across Maryland: the Youth Risk Behavior Survey, the BRFIS, the Maryland Comprehensive Assessment and Service Planning Tool that DJS uses, the Kansas used by DHS, which does have trauma-informed elements it captures. We have the HSCRC hospital case mix data, which can get at a lot of injury, intoxication events, overdoses, those types of suicide-related hospital emergency room visits, and it goes on. So there's a number of different data sources that capture data. So in summary, we identified 85 ACEs and ACEs-related indicators. 53 were being collected. The BRFIS and YRBS are the most commonly identified sources for ACEs-related data. Also identified many ACEs and trauma-informed related initiatives through this project. Don't have time, but we do have a PowerPoint that overviews in more detail all of this and goes through these initiatives in more detail. State agencies also identified additional data sources, but most of even with those, they really didn't identify too many new data elements to include in the inventory. Respondents also provided a whole lot of feedback on refining and the consistency of the language with the inventory tool. And it's a work in progress that we're continuing to update. Overall, when asking questions about how ACEs and ACEs-related data was being used, there weren't a whole lot of information there. People are using data, but there's no real structured approaches to using it in decision making. And we identified a whole number of data contacts from the agencies as part of this process. I'm going to skip here. Now I'd like to just introduce a new initiative that we are just starting, called the Behavioral Health Adverse Childhood Experience Initiative. The purpose of this project was to design and implement a collaborative initiative to provide essential data surveillance, training, technical assistance, quality monitoring, and continuous improvement services to support the adoption of trauma-informed policies and practices at MDH with a focus on the public behavioral health system. That said, this was designed with the commission in mind to really provide essential funding to support some of the key work of the Trauma-Informed Care Commission. We are committed to having this be a collaborative project, and as of this meeting, to invite the commission into the planning, and you're going to hear from my colleagues at the university in a moment about it, but we are committed to run this project as a trauma-informed project and with you with it. So a little bit about where it came from. We had the opportunity, which I did not want to miss, to take advantage of some funding from the American Rescue Fund Mental Health Grant, as well as a mental health emergency COVID grant to put some money towards supporting ACEs and trauma-informed care initiatives. The funding is going from July 1st, 2022. It might be a little later than that, getting through getting the agreement processed now through 8/31/25, so a little bit over 3 years. Our partners in this are the University of Maryland School of Medicine, the Department of Psychiatry, Division of Child and Adolescent Psychiatry, and the Systems Evaluation Center, as well as Bowie State University, who's also working with us on this. The funding for the initiative is just over $3 million for the entire period. And at this juncture, I just wanted to say that part of the vision for this initiative came out of work that Claudia Remington and a number of partners across state government worked on a ACEs Data to Action grant, which was a CDC grant. We unfortunately didn't get it, but it gave us the opportunity to build out a lot of ideas on how we wanted to push forward sort of ACEs and trauma-informed care initiatives in the state. So when this funding opportunity came about, we really took a lot of the ideas that a number of us worked tirelessly to put together, and we had more than 100 organizations who provided letters of support. We came close, but the good news is we had a lot of ideas to build into this funding opportunity. And now I'm going to turn it over to my partners at the university, Dr. Tiffany Beeson and Dr. Joanna Prout, to talk to you about their vision for this ACEs and trauma-informed initiative. Tiffany? You're talking, you're on mute. Hello? Can people hear me?
Yes, I can hear you, Jay.
Yes.
Tiffany, we can't hear you.
Joanna or Tiffany, I know you're on the line.
I'm here. Tiffany's it's talking, but it's not. I can't hear her. All right. Well, I can get us started, and hopefully Tiffany's audio problems will resolve.
Okay.
She's gonna log out and log back in, but I can. If you can hear me. I can get
Yes.
us started and she can jump back in. So we just wanted to take this opportunity to introduce this partnership. We've been excited for a long time, kind of lurking in some of your meetings to get an idea of what was going on, and are happy we have the chance now to more formally introduce ourselves and how we can support the work of the Trauma Informed Care Commission. So what we'll do in this presentation is describe who's involved in the partnership, talk about what we're going to do collaboratively, what our plans are, and discuss how we can work with the Trauma Informed Care Commission. And Tiffany is back, so let me hand it over to her and she can give you some information about her background. I don't know if we can hear you. I can't hear you, Tiffany. Sounds like you might be having microphone problems. But I'll keep on going and you jump in if you can. So to introduce the partnership, we have Dr. Yo at the Behavioral Health Administration leading the effort with his colleagues, Maria Radowski-Stanko and Delisa Worthy. At the Department of Psychiatry, we have people from Dr. Beeson and I are in the Division of Child and Adolescent Psychiatry, along with national experts in trauma-informed care and systems change, Dr. Sharon Hoover, Nancy Lever, Cindy Schaefer, many experts in child development and mental health, Cindy Schaefer, Kay Connors, Sam Reeves, and others. And then we have the Systems Evaluation Center team, which has been working with the Behavioral Health Administration for many years in doing data analyses to support their work. And that team, we have Di Sable, Tim Santoni, Karen, and Dr. Howard Goldman. And then we were very excited to have the opportunity to partner with Bowie State University with Dr. Latanya Brown Robertson, who has also been involved in the State Opioid Response Initiative evaluation, and Dr. Ashley Griffin. So when we started conceptualizing this work, we broke it down into 3 components, and the 3 components really all work together. As you can see, we have 3 bubbles or balloons or lollipops here, and then there's an arrows connecting them all. We have the first component is we're really looking to leverage the existing data about ACEs and related factors to learn about what's going on in Maryland. And take that information, as Dr. Yo just presented, there's lots of data. A lot of it's on an individual level, and we'd like to add to that by getting some systems level data. But we can use that to see what work is most important, and then if the work that we're doing is having the impact that we hoped. And then in addition to the existing data, our hope is to collaboratively select, create a trauma-informed organizational assessment that our partners can use to help guide their work to become more trauma-informed. And then in going along with these other 2 components, we're going to have training and technical assistance to help organizations build their capacity to be trauma-informed. And this is going to align with the organizational assessment and work together. And the vision is to have all of these resources available on one online hub. So you can go in, look at data, do your org assessment, connect with training and technical assistance in one place. So our hope is this partnership is going to bring time and resources to support the work of the commission. We really want to build on the work that's already been done and the knowledge and the passion for change that is already here. We don't have to start from scratch, as other states, Missouri, Wisconsin, other large organizations have been doing this work to become more trauma informed. and we can really dig into that information and work with the commission and other stakeholders to build a plan that draws on the best of that work and adapts it for Maryland's specific needs. So next slide. As Dr. Yu has said, as we go through this process, we really want to emphasize collaboration, working to support the work that's already going on. I've been really energized being in many of your meetings just to see the passion and energy for this work. And I'm really looking forward to, my focus is data. I love data, and data is very broadly defined: quantitative, qualitative, creative approaches, and rethinking what data means. Really happy to have the opportunity to support you all in using data to make this work. We're looking at cultural responsiveness, anti-racism, and equity. My colleague, Dr. Beeson, is the CARA lead for much of our work at National Center for School Mental Health, using evidence-based and evidence-informed interventions, really taking an asset framing and resilience-based approach. I've definitely heard, listening to these meetings, that we have a lot of data and information about the many problems in Maryland and how ACEs have a negative impact. And an area to focus on may be what people in healthcare systems and other systems can do to help make things better. How can they mitigate the impact of trauma and adverse childhood experiences? And we're going to be looking at systems change, so also focusing on a systems level to benefit individuals, and then working collaboratively so that what we do is sustainable beyond the life of this specific grant. And it sounds, I was hoping Tiffany would get a chance to introduce herself, but it looks like her mic is still not working. But just to emphasize, we really want to do this work in a collaborative and trauma-informed manner. One of the things that I've really enjoyed about the meetings that I've been to so far is that people feel like they can really express their thoughts and any concerns they might have. We want to keep that going. I think that will make this work stronger and more sustainable. And next slide. So feel free to get in touch with either myself or Dr. Beeson. We have our email addresses on these slides here, and I can also put them in the chat for you. But just wanted to wrap up and turn it back to Dr. Yo, and that we're really excited to be partnering with you on this work. I've always wanted to do a data to action grant, and I'm happy to have this opportunity, especially on the chance to make a difference in such important work with such a group of passionate people.
Yeah, I think we can open it up for some questions. I just want to say that, you know, the university is really, as I envision this, a support to this group. You know, while we have to focus to a certain extent on the behavioral health system for the fund, you know, around the funding sources, a lot of the tools and trainings we want to work with you to develop out. So to really see the university as a support to this work. When I put this together, that was the lead. I think collaborating with you guys was a lead sentence in a lot of the agreement. So we are looking forward to work with you as this project develops. Like Joanna said, we'll be putting together a steering group and wanting to have you involved in that and to help us guide this work out. So I think, Tiffany, are you able to talk now or not? No? So, all right. Not sure what's going on there, but that's too bad because I wanted her to be able to introduce herself, but we'll have other opportunities. So I'm going to open it up to questions.
Hi, Dr. Yo, this is Christine. I just wanted to share there was a question in the chat from Pilar from Frederick County. So she said that Frederick County is very interested in understanding how they can learn about the prevalence of ACEs among teen parents at the population level, especially given the importance of early brain development. And they understand that the YRBS doesn't capture whether teens are parenting and that it's not a question on the CDC's list of questions. So if there are any thoughts on how this gap could be addressed, either if you had ideas right now or if that's something that can be considered in the work moving forward.
Definitely something to be considered. I think when we were putting together the inventory, our perspective on that was that the ACEs wasn't the only data source, or the ACEs tool is not the only data source. There are a number of other data sources. I talked about the CANs and some other instruments that are being used that may get at more specific information. But what I would say, as we are developing priorities around data, to consider, to continue this discussion on what are those key elements. And I think you bring up a really important point.
Thank you, Dr. Yo. There's also two other questions in the chat that I just wanted to elevate. Matilla says, I know the commission's mandate is to focus on trauma. I am wondering if there has been any conversations in the state about studying or researching resilience, and what are the cultural skills and practices that individuals or communities are already using to help heal? And also, can those practices and skills be amplified and adopted in a systematic way to address the community level concerns?
I think, again, I thank you for bringing up that question. Focusing on resilience is going to be a focus on this. It's not only looking at sort of what has happened to folks and sort of asking that question rather than what's wrong with you. I mean, I remember when we were first starting to talk about those, that this is really a paradigm shift. So I think understanding the positive experiences as well as the more negative experiences is going to be key, and to have a more resilient focus as well. I don't know if Tiffany, if you can put anything in the chat as well. I think.
Yeah, this is really speaking my language, and something that I am focused on is how we can kind of, in some ways, rethink mental health supports to use work that's already going on in communities. So we know that it's something that's effective, that aligns with the priorities of the community, and build on that and use that moving forward. And we have some flexibility in focus and collecting data. I know we have different surveys that are going to go out each year. So doing some information collection about practices that are related to better outcomes in different communities is something that we can discuss further. I think we have a lot of information on negative events that have happened, and it may be part of this work to switch to learning more about factors that are associated with resilience and how we can capitalize on them.
Absolutely.
And Dr. Yo, I'm sorry, Dr. Yo.
Oh, I was just going to say, it looks like Fred asked, can you address a lifespan perspective and the related how and when of data collection? I think that's something we're going to need to work through with input from the commission and from our research team to really understand the best way to address that. But looking forward to additional conversations around that issue. Anything?
So I also, Frank put in the chat, he says, I appreciate the offer of collaboration, but a little confused about what that specifically means. For example, how do your goals for providing resources and technical assistance align with the Commission's training work group goals and efforts? Also, what voice or vote would Dr. Yo's group have within the Commission, if any? And also, is this collaboration something that we vote on as a commission? So I can speak briefly to kind of commission process. I think that's something we would need to, kind of continue to discuss of what those formal processes are. Again, we see this as a collaboration. Dr. Yo is currently not a member of the commission, so he does not have a formal vote. But again, this is an opportunity to kind of share ideas, share best practices. And again, it's for the commission to kind of decide what votes it would like to put forth. But we really see this as an opportunity of this initiative helping to fund and provide space to continue to support the work of the commission. Dr. Yo, is there anything you wanted to add to that?
Yeah, and I think, as I said, this project is just starting. It's not completed. The ideas aren't set. There's a lot of room for your input. And like I said, there isn't funding, and as it's been talked about in this commission a lot, there isn't funding for a lot of the work that the commission is, supposed to be doing. So this is really an effort to bring you, support some of that work. And so in terms of collaboration, we want to work with the various work groups. Like I said, we are, I disbanded the data work group we had going, so it could be taken over by the commission's work group, because that's, so there's not duplication of effort, and we can move forward with the direction the commission is going on. And I think we do need to hear from the other work groups in terms of really laying out the work for this initiative in the best way we can to support the commission's goals. So, we're going to be as collaborative as we can. We'd like to model a trauma-informed approach. Again, we had an opportunity for funding, and I was not going to miss it. It was before the commission got going. So, and I certainly welcome your feedback on how best to form this collaboration with you. So I'll end there. Claudia?
So I just wanted to add, to answer Frank's question a little bit, that, Dr. Yo and Tiffany and Joanna have also been attending the work group meetings, all the various work group meetings, so that they can share their perspectives. The commission and work group members can share their perspectives back and forth. So I think it's more of an informal at this point, collaboration, and it's they're members of the work groups, and I think, but there's this opportunity for them to share the funding with the work groups to do the work of that the commission may suggest, which there is no funding for. So it's an opportunity for us, since they're willing to collaborate with them and bring them into the fold, into the work groups, so that we can, move the work forward. Not sure how it would be done otherwise.
And I think maybe one of the confusions has been that we have like an existing plan ready to go, where we're going to say, do this assessment. We already have your TA right here, but we don't. We want to work with you and co-develop and select that. So at least I'm much more focused on the data piece, but I see our team is, looking at what other states have done, finding out what's worked, what hasn't, what's best practices. Let's look at this measure. Let's look at, this measure and bringing that information to the stakeholders so they can have a conversation about what will be best.
And I also just wanted to uplift what Tiffany put in the chat for members of Dr. Yo's team and Tiffany and Joanna and any other folks that you think would benefit. That the commission is having a visioning retreat in July. So we would love to have you come and join to either observe and we would encourage you to participate as well. So we'll share more information if you want to stick around for the remainder of the meeting. Christy will provide some more updates, but we can also follow up after the meeting with the details for that event. And we would really welcome your participation and anyone else that you think would benefit from attending that event from your team. So are there any other questions for Dr. Yo, Tiffany, Joanna at this time?
I would also just encourage people, if you have questions, please reach out to us. We're happy to talk to you in more detail about any concerns that you have and to work through those, because that's really a collaborative approach. I mean, we're not all going to be in agreement on everything, but let's work through and see how we can make this work for everyone.
Dr. Yo, everyone's also interested in the slides and access to the spreadsheet.
Yeah, I will send them out, and I'll send the materials around the landscape, the data inventory, I should say. But again, thank you all for the opportunity to talk to you today.
Thank you so much, Dr. Yo, Joanna, and Tiffany for being here. And we look forward to working with you and for commissioners and for work group members. They will be resources in our places and spaces as we continue to work together. Christine, you want to pull up the presentation slides, and I think I'll be turning it over to you to provide an update on the visioning retreat.
Okay. So the Commission Visioning Retreat, the date has been selected. It will be July 28th from 9 a.m. to 4 p.m. There are two options for attendance. One is in person. That will be in our office at in Crownsville, and that address will be sent out to anyone who's interested in attending there. And there will also be a virtual option through Google Meet. Registration will open today. That registration link will be posted. There it is. There's the address. Sorry. The registration will open today. It'll be posted on the website, on the Commission's website. So you can go ahead and go through the registration link, and I'll provide more information from that. There is a planning committee. If you did have interest in joining the planning committee and have not as of yet, please let me know. The planning committee has met once. We will meet again today, this afternoon, and then we'll be setting up meetings after that. We have the help of the Anne Arundel County Conflict Resolution Center as facilitators, which is very exciting. They'll be coming and providing primary facilitation as well as secondary facilitation for small group discussions. They are going to be not only providing facilitation, but also assisting the planning committee in creating a plan for the visioning retreat so that we have a plan in place about what's going to happen. They're going to come to the July meeting on the 21st, to the July Commission meeting on the 21st to kind of set the stage for the visioning retreat and kind of put some things in place. There will probably be a survey that will be sent out to Commission members to kind of ask some questions and get people thinking ahead of time. So all of that's coming, and you'll be hearing about that through email, etc. In terms of registration, there are 3 types of tickets when you get to the Eventbrite page. The first is if you are a commissioner or a work group chair and you are going to be attending in person, that is the first type of ticket. if you are attending in person and you are a work group member or a member of the community. The third is anyone who's attending virtually. Okay, the meeting is scheduled online on Eventbrite as a virtual meeting, but it's for both. So it's whether you're attending in virtually or in person, but you will be given a confirmation if you're attending in person with the information about how to get here, with the directions to the facility, et cetera, et cetera. If you are attending virtually, you'll get a confirmation with the information about the Google Meet, et cetera. So please feel free to register. Please do so as soon as possible so that we can make sure that we will, okay, it says that they go on sale July 21st, but they'll be available today. So anyway, but yeah, so please register as quickly as possible. It is from 9 a.m. to 4 p.m. Again. And so I'm sorry, I'm trying to answer questions and my brain doesn't switch over very quickly. So that's why I'm kind of all over the place. I apologize. Register as quickly as possible, because again, we're going to have facilitators that are going to facilitate small groups, as well as facilitators to facilitate online participation as well. So to make sure that it runs as smoothly as possible, the sooner you can register, the better. Just, to do that as quickly as possible so that we can make sure that it's planned properly, because we want to make sure that everybody has, participation and the ability to participate very, very, as smoothly as is humanly possible. We want to make sure that we hear from all voices, et cetera. So any questions about the visioning retreat that I might have answers to today? No? Okay. Okay, Claudia? You're muted.
What's the distinction between in-person commissioner or work group chair and the work group members or public?
I can take that one. So Claudia, we just wanted to do that because, well, we don't anticipate capacity issues for the actual space. We just wanted to separate them out so that within the registration, we can ensure for in-person that if we do, for some reason, exceed in-person registrations from our space capacity, that we can easily prioritize commissioners and work group chairs. So again, we don't anticipate having to create a wait list, but we just created those different ticket identifications in case we needed to do that.
And again, if we were for some reason unable to accommodate everyone in person or everyone who wanted to attend in person, the virtual possibility is always there for everyone. There's no limit to the number of people that can attend virtually, but there is a limit to the number of people that can fit in the conference room. It's a large number, but there is still a limit. And there was a question in the chat about whether the link to registration would be in the chat, and I'm not sure. Kelly, can you put that in the chat, or will it just be on the website?
I can do both. I'm going to open it up right now. So give me like a couple minutes.
It'll be in there before the end of the meeting.
Yes. Yep.
Okay. We're working on it.
Janice?
Any other questions or thoughts about Janice?
Yeah. Hi, Chrissy. Are you encouraging people to come in person? And in terms of the day, if people have a choice, would you suggest that people come in person or come virtually?
So again, my personal preference is always to attend in person because I feel like interaction is more thorough and there's a better interaction that way. But some people are just not going to have that capability either for time purposes or for distance, or some people may have, issues with family and COVID, and I don't want to assume anything for anyone else. I don't want to make anyone's decision for them. I would prefer in person. I think in person is more, it provides more in-depth interaction with one another. But again, we will do our best to make sure that everyone, whether in person or online, receives as
Excellent.
quality and interaction as is humanly possible.
Wonderful. Thank you.
Other thoughts, questions, concerns, ideas? Okay.
All right. Thank you so much, Christy. So again, if folks are interested in participating in the planning committee, please reach out to Christy. We do have a meeting, like Christy said, there is a meeting later this afternoon. So if you would like to participate at that, it's from 3 to 4. It is a virtual meeting. And again, more information will be shared out in preparation for the day. So please continue to monitor your email for updates regarding the retreat and additional instructions. So now moving on, really excited that we have the opportunity to have the work group report outs. I know just from the nature of our meetings from the last couple of months, we haven't had this opportunity. So want to be able to give work groups the opportunity to report out on what they have been working on or questions that they might have for the group today. So I'm going to start with the core values and definitions work group. And Christy, I believe you'll be providing the report out.
Yeah, the last 2 meetings of the core values and definitions work group has been primarily looking at what the group wanted to say in the report, in the legislative report, and most recently what the group wanted to say in terms of what they would like to see come out of the planning of the visioning retreat. That's been primarily the focus. The most recent core values meeting was small in attendance, so trying to plan a new date, which we were not able to select as of yet, which is probably my fault. Again, so that's kind of where we were at, and the group is looking at various developmental models, so that they can then put together kind of what are some of the similarities between them and create something that they can then present to the commission for consideration. Anyone else on the group want to make any comments or add anything to my very brief report? Anything that I missed? Okay.
I will also add too that this work group currently doesn't have a chair. So Christy is serving as staff and helping to lead that. But we will again make the call that if there is anyone who is interested and willing to step up and serve as chair, we would greatly appreciate. You will be supported by Christy and and commission staff. You will not be in it alone. There is staff support, and Christy will be right there, almost as serving as co-chair, but we would really like to have a member of the commission or a member of the public to step into that leadership role. So moving on to the metrics and assessment, are either Kay or Margot with us today? Christy, I don't think I see Kay or Margot here with us. Is there anybody from the metrics and assessment work group who?
Jay might be able to.
Yeah, I was just going to say, I know Dr. Yo mentioned that, the ACEs data work group will be combining with the metrics and assessment work group, and they have been participating in those meetings. So I don't know, Dr. Yo, if you feel comfortable or able to provide any.
I'm happy to, and there's a couple of other people here who've been attending as well. We actually the group just met before this meeting. I think the feedback of the group, there's been a number of tools being put together to sort of look at what organizational assessment tools are out there. Obviously no decisions or anything like that has been made. There's a concern that we really need to understand the direction the commission is going. I think the visioning retreat is, going to be really valuable in that way. Before any decisions get made on tools or training or any of that, we sort of need to know what are the key outcomes that the commission is focused on, and then we can sort of move forward with the work. So we're postponing the meeting in July, and then we'll be meeting again in August to take up the work again. And I can have Claudia has been a part of that. Is there anything you want to add?
You did it. Good job, Jay.
Thank you.
All right, thank you so much, Dr. Yo and Claudia. So now I'm going to move us over to the training work group and Amy and Janice.
Hi there. I think Amy and I are both here, and she's going to share a slide. I think what Dr. Yo, thank you for the presentation today. It was really helpful. And I think what you just stated is exactly where our training work group has been, that we've been trying to figure out how do we contextualize what we're doing within the larger process. So there's a lot, and how do we prioritize? So Amy, want to move on to the next slide. So we have met 3 times, and we had a fabulous presentation at our last meeting from Shalara Sessions from the Resilience Committee work. And we can share the website. It's a really inspired project based in the Department of Health. And we're really looking at the resilience work in terms of the context of thinking about training. Amy, if you want to go back and forth, and if you want to talk about.
Sure. Yeah, sorry, I was having trouble coming off mute. My screens are all over the place right now. Yeah, so I was going to see if I could find the website really quickly, but I didn't want to lose our screen, so I'll do that before we hop off. But yeah, so we had a great presentation from Shalara, and spent a little bit of time talking about some of the draft recommendations. But I think where we spent, the most of our time in this most recent meeting was really talking about the agency reports, which we reviewed. And I think, Janice and I were texting during this meeting, just saying how helpful Dr. Yo's presentation was, and just helping us starting to kind of like just form, an understanding of what the group's looking for. So it was really helpful. So thank you, Dr. Yo, for that.
And so we will be identifying key messages to share in our next meeting, now that we have a little more context. And we welcome you, Joanna, and your colleague to come to our work group as we work on getting ready for the visioning retreat. So
yeah. Thanks, everyone.
Yeah, thank you.
Thank you, Janice and Amy. And so then I think next is the operational implementation and technical assistance work group. So that's Elizabeth, Inga, and Michael.
Yeah, I'll take this on today. We, like a lot of the other committees, are in a waiting pattern until this visioning event happens, to give us some guidance, because if the commission is in agreement, we would like to focus our implementation around the 10 organizational domains that Samsa mentioned. So, but we need to get that voted on first. We have been talking about an implementation from the broader sense, like who do we need to bring to the table? How do we work with different agencies, especially those who do not feel that this is critical to their work? So we're talking about it more broadly, and we're meeting again next week. So that's where we are.
Great, thank you so much, Inga. Then moving on to the public awareness.
Just to interrupt very briefly.
Oh.
The links are in the chat for the registration. So if you want to copy and paste that somewhere, everybody is there now.
Thank you so much, Christy. And also, too, if you aren't able to capture it here in the chat, it will also be posted on the commission website. So you will be able to access that, and it'll be followed up in email as well. So it'll be in multiple places and spaces for you to access. So, like I said, moving on to public awareness. I don't know, is Ulysses with us today? I don't think Ulysses is with us. Is there anyone from the public awareness work group that feels comfortable sharing? Or Christy, I know you've been in those meetings. If there's anything you wanted to elevate up.
Claudia, is this something that you can handle?
Yeah, I can share. So the work group is meets every 2 weeks. And they did make 2 recommendations that were included in the trauma-informed care report to the General Assembly and to the governor. The first was that they recommend that resources be allocated for the development of a knowledge mobilization campaign, employing both the science underlying trauma, neurobiology of stress, epigenetics, ACEs, trauma and resilience, and communication science strategies, which are knowledge, translation, and mobilization, that incorporates a common unified language and methods of communication when communicating about trauma, adverse childhood experiences, healthy, social, emotional, and physical development, and resilience across state agencies. And then the second recommendation was to recommend that resources be allocated for the state to partner with Frameworks Institute to learn and effectively use research-tested communication strategies to develop an in-depth communications plan that can be implemented by state agencies and local communities across the state to mobilize knowledge aimed to support Maryland's statewide strategy toward organizational culture shift into a trauma responsive state government. So in continuing to look at those recommendations and kind of putting some meat on the bones, we have invited Pilar Olivo, who's been using this in Frederick County and who's on the call today, to come and speak to the public awareness work group at our next meeting, which is, I think, next Tuesday, from 10 to 11:30, if anybody's interested in coming to join us to hear more about how they're using that communications, that kind of 2 science approach. We're also looking, there's also some additional funding at the Behavioral Health Administration that we are looking to use in some way to support, just similar to Dr. Yo's program, that might bring in some support for the work of the public awareness work group in the commission, and bring in frameworks to help at a statewide level. And they also are very eager to have visioning sessions so that we ensure that there's a coordination between the work groups and we have a bigger vision that we all share and are working towards. Thanks.
Thank you, Claudia. And so then moving on, last but not least, is Carrie and the ACEs Aware work group.
Hi, sure. Hi, guys. Nice to be here with all of you today. This is my first time joining you because I had other conflict in my schedule that was up until June 1st. So glad to be here. Just a brief report out from our group. We meet on Monday for our 3rd meeting. When we met last month, we talked about really looking at and having a better understanding of what is currently happening around the state. And so the presentation today, Dr. Yo, so timely, and it's always good to hear you speak, and you're just do such a good job of really laying it out for us. So thank you. Look forward to our conversation in the chat where our group will, learn more from this data. We also put out a survey a couple weeks ago to our local management boards and the local behavioral health authorities across the state to ask about contacts in jurisdictions and who is doing some of this work or who we might need to talk to and get to come and present to our group around findings that they have found on different models, and really focusing on what that implementation is going to look like. There's a lot of worries, concerns, and just curiosity around, once we've identified these indicators, what do we do with that and how do we support that kind of throughout? And so making sure our group is really interested in making sure we don't lose sight of that. Another thing that we're doing is on Monday, we have Dr. Howard Dubovitz coming to speak with us around the SEEK kind of model in Maryland, as well as his recent articles around ACEs and models and implementations. So we're excited to have him come and share his findings with us and give an opportunity for the group to ask questions. And then after the visioning retreat, which like everyone else, we're all super excited to have a little bit more guidance and direction on. It's just been really important that we make sure we're in line with what we're being asked to do and that we can bring a deliverable product back at the end. So once we do that, we'll have a little bit of a clearer understanding, is our hope, for who else we need to invite to the table to be speaking with us. And in the meantime, we continue to do reading and research on the different models that are presented to us. So that's all I have for today, unless anyone else on the call wants to add something I might have forgotten from our group.
Thank you so much, Carrie, and we're so glad that you're now able to join us in this space, and we look forward to continuing to work with you.
Sounds good. Thank you.
So I think moving on to next steps, like Christy mentioned, we are going to be having the July work group meeting, which will be on July 21st. So it'll be our same time. Same link. So that is going to be facilitated by the retreat facilitator. So it'll be an opportunity to share more information about the facilitator's plan and the planning committee's work and agenda for that day. It'll be an opportunity to ask questions, but also to pose some questions and a little bit of pre-work. I just want to warn everyone that there will be a little bit of pre-work to help prepare for the retreat and the day, both to help commissioners be prepared for the day, but also for the facilitators, so that they can properly prepare, their staff and kind of leading the group through that work. So again, there will be the meeting reminders and the links sent out to your email for the July meeting. And then also again, the following week, July 28th will be the all day planning retreat. Work groups will continue to meet as they have deemed necessary. For our work group chairs, if you can provide just a quick written report out about activities that you wanted to share with the commission, we'll make sure to put all of that together to be sent out prior to the meeting. That can be very in-depth, and we will, if need, put a little bit of time on the agenda for some kind of oral presentations, but we really want to give our facilitators the time that they need to help us prepare for the day. So any written updates you could provide to Christy would be great. And before I close us out for the meeting, I just want to take a quick moment to recognize a member of the commission who you all may be familiar with. Claudia Remington has shared in lots of places and spaces that she will be retiring at the end of this year. So we just want to take the opportunity to thank her for all the work that she has done, not just on this commission, but with SCAN and all the work around ACEs and bringing ACEs work to Maryland through ACEs Master Trainers and the Maryland Essentials. We want to just thank you for your commitment and your dedication and service to the children, families, and everyone, you know, all the people of Maryland. For our commissioners, Claudia has said that she will still be around. She will still be engaged. It might just be in a different capacity, but I just wanted to recognize all of the work that Claudia has done. And I just wanted to open it up to Claudia if there was anything that you wanted to share.
Thanks, Christina. Just that it's been an amazing honor and pleasure to be serving on the commission and just doing all this work for many years. It's really rewarding to see this. And I know that it seems frustrating, but I will tell you that it's been a long time coming to this point. And this is legacy work. This doesn't happen overnight, and don't get discouraged. Just keep on. It's step by step. You know, the work that Pilar is doing in Frederick County, using the YRBS. Years ago, we asked that the ACE questions be included in the YRBS, and we were told no. We were told no, even by the CDC's part of a division of the CDC. But once we sat down and talked to folks, you know, people understood how important it was, and we became one of the first 2 states to collect that data. And now Pilar is taking that data and running with what Nicardi has been able to do with that data and doing amazing things in Frederick. And that's going to happen all over the state if we just keep doing this work. And like Christina said, I'll still be involved in the work groups, and I'm very happy to announce that Wendy Lane, who is a physician, a child maltreatment pediatrician, an epidemiologist at the University of Maryland, and who knows this work very well, will be the designee for SCAN, and just continue the work keep going. So, and if anyone's interested in applying for the position of SCAN, let Wendy know, because she will definitely be ensuring that somebody gets appointed hired for my position as well. So, thank you. Thank for the kind words too.
Well, again, thank you so much, Claudia. Again, we just give much appreciation and gratitude to you and wish you all the best in your retirement. I know you said you're going to continue to be involved, but I hope that you do take some time so that you can enjoy your retirement and take some time for you as a reward in recognition of all of the hard work that you have done over.
Oh, I will be. I'm going to Egypt and New Zealand already. I have plans. So yes, I will be enjoying the time. And
well, I'm
very
sure I'm
great.
not the only one in wishing you safe travels, and I hope that you are able to enjoy that time. So, Christy, I don't think there are anything else. So again, if you have any questions about the meetings or links to registration, please reach out to Christy. Also, myself and Kelly are available if needed, but Christy is your main point of contact. We will update the commission's webpage with more information so that you will continue to have access to that. So we thank you all so much for joining us here today. We look forward to seeing you twice in July and for all of the good work to come. Hope that you all have safe plans with your family and safe travel. And without further ado, I would call for a motion to adjourn the meeting. Motion to adjourn.
A second.
All right. Thank you, Matilda and Fred. I hope you all enjoy the rest of your day, and we will see you in July.
Yeah.
Kelly, do you need me to save the chat?
No, I got it.
Okay.